again live here at CMU. Grateful to be here with my colleague and friend, Dr. Amy Bronson, to provide one of our regular updates from campus. Today we're going to be chatting with you directly about COVID in the first couple weeks of the semester. 2 weeks ago, I think we sat here right ahead of the beginning of the semester, and we came to this conclusion that based on Omicron's running rampant both statewide and here in Mesa County, and based on this really unique window that we were in at that time, which is that this Omicron run over the Christmas break was really the first time where our university didn't have a really strong line of sight into the data of what was happening. We had that with the surge in Delta, we had that with some of the early on places with the pandemic, but we were a little bit blind over the Christmas break, right?
Yep.
So we made the difficult decision to create a defined period and a defined place, and for a defined purpose, a masking requirement in academic spaces for the first 2 weeks. And the reason that we articulated for that was specifically to allow us to gain that line of sight into the data yet again, which has been the strength of our program all along, right, Dr. Bronson?
Absolutely.
Well, we're glad to be back here 2 weeks later and to tell you that the data has, well, let me just pause right there. You know this data a lot better than I do.
Yes.
Dr. Bronson, why don't you just jump in here, share with our audience at home what we've learned over the last 2 weeks, and I know as questions are coming in and everything else, we'll try and tackle those, but maybe just give us a high level. What have we learned over these last couple weeks?
Absolutely. The data is so important for us to analyze. It's been so important for our approach, and that's what our team has really been doing over the last 2 weeks, is trying to have a better understanding of reinfection rates, what is that looking like across our campus, and more specifically, this Omicron mystery that we kind of headed into the semester with, what is that going to look like in the classroom? And I think the good news is we've looked through that data, we're still seeing lower reinfection rates, low campus transmission, and really no transmission that's happening in the classrooms. Our classrooms continue to remain a safe space on campus. And when you really pull that together and also take in what's happening in our broader community with Omicron and cases really starting to tail off here in Mesa County, our hospitals able to really sustain what we've been seeing with case counts, we feel really confident in moving forward with a more defined and back to where we were, able to surgically kind of come in and make mitigation strategies that are based on places where we know there's higher risks versus making wide sort of breaching decisions for our campus.
Or something, right?
Yep.
So, you know, maybe just summarizing some of the things that we've been looking carefully at are, you know, over the last year and a half, we've seen exceptionally low reinfection rates among college students. We haven't seen meaningful outbreaks, in particular this last fall. We didn't see any meaningful outbreaks among Mavelis. We saw a few very discrete ones that you and your team were able to quickly respond to, which was one of the things that we wanted to validate, that data, that evidence, continued to be the same this spring, right?
That's right. Yep. And as we started to learn more about Omicron, one of the things that we were really looking at is this higher level of transmissibility, and is that going to change and need to shift our response? And I think we've really come back around to say our response and how we've been looking at this continues to hold as a very great approach for being able to mitigate any large outbreaks that are going to happen on the campus. And so I think as we look at sort of turning towards what spring semester is going to look like, we feel very confident relying on the plan that we have done, a data-driven approach that's really had a lot of medical and health advisory experts that have said, yes, let's do that, and let's continue to do what we do well, which is utilizing all of our tools here on campus to continue to drive that data towards making decisions for certain pockets of the population that we know we're going to have to put in different mitigation strategies.
So one of the questions that we got earlier, and maybe we'll just start here, is around in the wintertime, the air exchanges that are happening in the classrooms. We know that's been a critical part of our strategy, is turning up those air exchanges all through these classroom buildings, office buildings, et cetera, to really ensure that we're moving air at, I think it's 2.5 air exchanges an hour is our target, and also using those ramped up, more expensive air filters, right? And I can never remember the name of those.
The MERV 13s.
The MERV 13s. But using those higher grade filters that have been demonstrated through research to help mitigate against spread.
Absolutely.
And appears to be a really effective tool for us.
Absolutely.
Yeah.
Yeah, and I think when we really look at all of the different strategies that we have deployed, we've continued to say not one thing is going to be a silver bullet, but we're going to continue these layers in how we respond to try and ensure that what's happening here on our campus is considering everyone's health and well-being in our decision making.
So one of the things that we have continued to push hard on is asking students to show critical thinking and leadership in making decisions for themselves about what's going on in their wellness, about what they're doing to mitigate and protect themselves and protect others against the risk of infection or transmission. And one of the things I think you've pointed out is that, you know, while this hasn't been something that we have mandated, we've continued to encourage really deep thinking from young people about the use of the vaccine, purpose of the vaccine, and whether it's appropriate for them to get a shot, and making it widely accessible, right?
Absolutely. And I think as we have driven from the beginning, education has been paramount to what we've been doing in our pandemic response. It really continues to be that. Let's dive into some conversations around critical thinking of what this means, not for us just right now, but in the future, as we digest data and make really informed decisions about our overall health and well-being. And that continues to be what we push forward this spring.
Yeah. One of the things that we did not talk about is the fact that while our case numbers are, I guess you would say, low to modest, I mean, they're less than 1% COVID burden on campus, right?
Yep.
Those numbers specifically on campus residents, one of the places we watch the most closely, continues to be a fraction of our total cases, which is to say a fraction of a fraction. And so one of those questions that we've been looking at is, what's it look like in our residence halls? We know that that's congregate care from the get-go. That's been one of those areas where we've watched really closely. And the good news is we continue to see very modest, as I said, a fraction of a fraction in terms of what's happening on campus, right?
Yep. And I think it's sort of true to our campus and those Mavericks that have really looked at this and said, we can and we will help make decisions that are going to be most important for our health and well-being, not only for ourselves, but for the greater Mavely. And we have seen that, you know, whether it was pushing out campaigns around remembering that universal precautions, things that we do all the time during cough, cold, and flu season, washing our hands, making sure we're not touching our eyes and our nose, really making sure that we're sleeping well, eating right? Some of those things that we know make us healthy and well outside of the normal pandemic are important.
Well, and during a pandemic, we've also learned that things like cold and flu still exist. And our students clearly, you know, I mean, I would say we have one of the most aggressive and ubiquitous testing programs out there. And we've learned that students are still getting sick from time to time, and it has nothing to do with COVID and has to do with cold and flu, right?
Yep, absolutely.
So those wellness, I guess, coming full circle, those wellness strategies matter for all of us, not just as a COVID precaution.
Absolutely. Yeah, and I think as we look at rolling out what is Healthy You here at CMU, really taking our pandemic response, and we know we've elevated a better understanding of what does this mean to be healthy and well, and sort of this public health response around a pandemic has really highlighted there are ways that we could probably elevate how we are caring for ourselves and one another here on our campus. And we're excited to look at how we can continue to build that wellness infrastructure here at CMU to better care for each other.
One of the things that we've been watching carefully is the stress that we as a campus are putting on our local healthcare system. And maybe we could just talk about that for a moment. It appears that the national narrative around Omicron, that it's more transmissible but less severe, has played out in spades here in Mesa County, has it not?
Yeah, and I think when we really look at, and I really have to give a shout out to all of our colleagues and those that have worked tirelessly through this entire pandemic to care for our community, really thank you. We are so grateful for what you have done, and we know that the burden has been huge, right, on time and effort and all that they have done. But I will say, I think when we start looking at the data, certainly a lot more people are getting COVID. That is starting to tail off here in Mesa County, which is great news. But just by sheer amount of numbers of people getting COVID, you're going to see higher volumes, right, that are going to need hospitalization. But I think really when you look at the severity of disease and what we're having to treat due to severity, people on vents, number of days in the ICU, we are seeing a difference between that Delta cases and Omicron cases. And I think there is that bit of silver lining as we look forward to what's coming.
And of the cases that we've seen on campus, have any of those translated into hospitalizations?
No, none that we know of that
Yeah.
or anyone in our campus community has needed long-term or more critical care
Yeah.
in our hospital system. So,
Well, we'll continue to watch that carefully, but as we think about these questions, what are you doing and why? We know that our goals remain the same. How are we delivering an outstanding world-class education in person? Specifically that we know our student population needs that.
Yep.
They've told us that. You've all told us that. So we're working to make sure that that is protected. And continuing to track how our decisions affect the community around us. Are the healthcare system assets being stressed by our campus? And so that's something that we'll continue to watch closely, obviously. That's, we're pleased to, I guess, report that we haven't seen a lot of real stress being created by this campus on our healthcare system.
absolutely.
Yeah.
And as a result of that, I know you sent out a campus communication earlier today, and I think maybe fully announcing what
Yeah.
that is and what that's going to look like is important.
Yeah, we've really tried to take that approach of restrictions only go in place in those discrete areas where we know that they will be for a very specific purpose, for a very specific time, and for a really specific population. So we're pleased to report that the masking that we did in the classroom for 2 weeks for a specific purpose, which is to allow us to get line of sight back into that data, those objectives have been met. And so we're going to be moving away from that restriction starting this Saturday. Students will be back to mindful masking, which is to say we're going to ask you to make good decisions about whether or not a mask is appropriate for you and for those around you. But there will be no mandate around masks heading into the rest of the term, just like as in fall term, which we really think is an important part of continuing to learn to learn to live with COVID as sort of an endemic part of life.
Yep.
And returning to a sense of, I wouldn't say not worried about it or not, or kind of relaxing our guard, but simply learning to make good choices day in and day out, not living in fear, not leading in fear, but rather relying on the evidence. And again, get back to this question about how are our students experiencing this moment? I had a great conversation with some student leaders last week about this idea that yes, COVID has put some additional stresses and strains on all of our lives, but there's no reason why we shouldn't be engaging in this semester in joy and enthusiasm and excitement, because you only get this experience once as a student, and so we want to continue to really lean into that. Yes, we're gonna keep a close eye. We're gonna keep these mitigation strategies there, but we're gonna provide students with as much joy and enthusiasm and freedom and latitude as possible. While we try and manage this moment.
Absolutely. We really leaned in this semester to learning together and leading together. And I do think that that is so important as we talk about education, what we do here as an Institute of Higher Education. Masking, right, and when to mask and some of these mitigation strategies that we deploy. We've had a lot of questions about that, and I think the team has done an incredible job of reaching out and saying, that's great, let's have a mask fair.
Yeah.
We had a lot of great conversations with folks about different types of masks and what types of masks to wear and when. And so our team has done a really great job. If you haven't visited our website, go to coloradomesa.edu, go to the COVID-19 website. You can pick up some information on masking or mask guidelines, and it sort of goes through what is our mindful masking, kind of helps
and that
define
mask guidelines looks like the guys are pulling that up now. So as the campus community, parents or others have questions about this masking idea, I know your team has really leaned in to try and provide a lot more information, provide good resources. And I think at this stage of the pandemic, maybe we're all a little fatigued about this topic.
Absolutely.
But really compliment you and the team. I know, our former regional epidemiologist that you've been able to hire on here at CMU, Andy Tyler, has done a great job with that, has really the whole team managing this, but really appreciate that resource for our campus and community.
Yeah, it's amazing. And I am going to give a shout out to the team because they do so much behind the scenes. Andy Tyler has come over as the co-chair of the Infectious Disease Advisory Committee and really has an incredible lens of what he did in response at Mesa County Public Health,
Yep.
and now is translating to what we do here on this campus, and has led in the data in our ability to really sharpen our pencil this semester on what we know about transmission and where that's happening and how we can respond. So very grateful. Emma Lienerman continues to lead the charge. She's incredible at making sure that we have testing and testing available. And just a reminder,
and you're operating 2 sites, right?
We're operating
you're continuing
2 sites.
to operate 2 sites, a rapid and the drive-through PCR.
Absolutely.
Yep.
And just a reminder to our community, our rapid tests, we really are trying to make those for those that are symptomatic. That is really important in our response. If you are having symptoms, we want you to be able to get that rapid response. If you're going to test for other reasons, close contact, our drive-through site and our partners at Summit Lab have really dialed in and are able to get those tests back very quickly. We're going to recommend folks to go out and do that PCR first. But the 2 testing sites are still running, and then Michael Hughes continues to run with our contact tracing team and continues to be such an incredible resource for folks trying to navigate what to do after they test positive or have a close contact. So just really grateful for the incredible work of that team.
And the testing, the testing site that the team just pulled up there is really important, I think, for our campus and our community to, we have this blessing of having those rapids available, but they're not inexhaustible. So we really, I would just reemphasize, let's use those rapids strategically and not just burn those up. So let's try and protect those for those on-campus symptomatic individuals who are part of our campus community, and really taking advantage of the great drive-through testing site, which frankly is continues to be one of the best anywhere. And they're turning those around really, really quickly.
Yes, they are. Yep.
We appreciate that very much.
Yeah.
Let's see, as always, if you have questions, I want to maybe highlight the fact that we've made a shift away from the safety@coloradomesa.edu email. That remains an email that you can use, but pre-pandemic we sort of reserved that for life safety issues, whether that's campus security or whatever the case might be. And I think as we've moved through this pandemic, we're moving much more, as you said, toward more of a lens of wellness. And so we're using that health@coloradomesa.edu to try and help field questions around COVID and the pandemic. So if you have a question about any of this, reach out to us. If you've got a situation that you need some additional conversation about, we've talked a lot about classes. Don't go to class symptomatic, but if you have a question or there's something that's not happening the way you think it should, reach out to our team at health@coloradomesa.edu.
Yep, that's exactly right. And just a reminder, I think we've talked, a lot about the masks in this conversation, but a reminder to our campus community, we have a lot of tools that are in place over the spring. Remember to utilize Scout if you are symptomatic. That helps trigger one of our team members to reach out to you. Also remember, yes, please don't go to class if you're not feeling well. Log those symptoms, go get a test if there are COVID-like symptoms. And also a reminder of the Classroom Illness Impact Form. That's been a really important tool for us to have communication and more transparency with those that are in the classroom, and our frontline faculty cannot thank you enough for the work that you're doing, and that is such a great communication tool. So please continue to utilize that to have conversations with our team around what's happening.
Yeah. Dr. Bronson, the other thing we had talked about in, I think, November, December here when we were chatting with the campus prior to the break was about the genomic sequencing. We continue to do that work with the Broad Institute, and I gather you had some updates on that have allowed us to continue doing that work. Is that right?
Yeah. A big shout out. We have said from the beginning, partners make this possible, and our partners at the Broad Institute continue to be incredible, not only experts in the field, thought leaders, but their willingness to not only critique our plan, but then help us to be better. And one of those is being able to deploy this incredible technology of genomic sequencing, where we have real-time look into what is happening on our campus at the genomic surveillance level for the virus. I will repeat, for the virus. So this is genomic sequencing that's happening around the virus. The really cool part is our partners at Fathom, who have continued to help us in being able to visualize all this data that has really helped us be able to make these decisions. We now are able to pipeline that genomic sequencing data right into our Fathom dashboard, and we'll be able to have real-time ability to know even more about what's happening around transmission on our campus, which is really exciting.
The reason that data matters is because ultimately it allows us to make very specific decisions and not sort of broad sweeping dictates for the entire campus, but really focus in on where we see pockets of transmission that we need to address, right?
Absolutely.
Allows us to provide the maximum amount of flexibility or freedom to the most of the campus,
Yep.
while continuing to not lose sight of individual transmission or hotspots, right?
That's right. And I think the really important piece when we think about not only the nimbleness of our response, but our ability to know what new variants are coming
Yeah.
is so important to what we do here. Omicron, A2, right? We're continuing to stay in this data in real time to really know how that might affect our campus. And that right there allows us to be able to have a data-driven plan that has driven this from the beginning.
Let's go back to vaccines for a quick second. We suspect that the vaccine is well, we don't exactly know how it's impacting with Omicron, right? We do know that it's been pretty effective with Delta and the earlier variants. Mm-hmm. One of the suspicions, I'll say not as a known fact, but one of the suspicions is that the vaccine could be really important against maybe future variants. Mm-hmm. And so maybe talk a little bit about what are the agreements you've got in place to get vaccine bus here on campus and make that accessible to students? Absolutely.
Yeah, thanks to Mesa County Public Health and our partners at CDPHE, we will be bringing vaccines, boosters back here to campus 4 different times mm-hmm. in the very near future. And you can actually visit our website. We actually have updated dates and times that they're going to be here on our campus, giving more immunization access. We are continuing to encourage folks, have a conversation with your healthcare provider. I think that sometimes is the piece that has been missing in some of our response around this is find a trusted person that you can have an honest conversation about your own sort of risk profile, health and wellness around getting that vaccine. And we're going to make it really accessible here on campus.
Well, we know for a fact those who are immunocompromised or in higher risk categories benefit from those on a population statistical level. But to your point, you know your health and your doctor knows your health best. And so we just continue to ask you to really take personal ownership of that conversation. And if you have questions, if you need to chat with somebody, we've got a bunch of great resources available for you.
We do. Yes, please reach out to our team.
All right. If there are no questions online, it looks like we're just checking here that if there's no further questions in the current Facebook Live session, we'll just direct those ongoing health@coloradomesa.edu. Shoot those questions over to us. Our team's standing by ready to assist, but really excited for the semester getting back to normal and as we said, leaning in and just having an outstanding experience for our students heading down the stretch here in the spring term. So Dr. Bronson, anything else that you see that we want to tackle before we sign off?
I think if you have any questions specific about masks, about what types of vaccines are going to be available at our vaccine clinics, please just reach out to us at health@coloradomesa.edu, and we'd be happy to have those conversations with you about what specific vaccines are going to be available and what that's going to look like in timing and how to access that. So please reach out to us if you have any further questions.
Great. All right, until next time, thanks so much for all of your support and ongoing dialogue around this topic. We'll sign off and see you next time.